Thank you again for inviting me along today. What I wanted to talk about was some work we're doing to kind of develop how we explain and inform to people living across Dorset and Hampshire and the Isle of Wight about how information from their medical records is shared for their benefit, and also the kind of sort of measures that are put in place to do that safely and securely, and hopefully kind of build some kind of trust and confidence in how that is done. What I'd also like is perhaps at the end any ideas that you may have about how we can engage people in the things that I'm going to talk about. I've also got a very little straw poll at the end, which, if you don't mind taking part in, is something we're working on at the moment. So just to give you a bit of background, so what is Wessex Care Records? Well, Wessex Care Records is a kind of partnership between the Dorset and the Hampshire and Isle of Wight Integrated Care Boards. It was originally set up to really enable the Dorset and the Hampshire patient record systems to talk to each other as IT systems, so that information could be shared by doctors' hospitals across both, well, 3 counties if you include the Isle of Wight. So, for instance, if you had an accident in the New Forest, you were taken to hospital in Bournemouth, doctors there at the hospital will be able to see your records held by your Hampshire GP. Or if you live in, say, Dorchester and you come up to Southampton to go to the eye hospital or one of the specialist services, the hospitals will be able to access your GP records. And this is something that's happening across the country, different record systems joining up. But in fact, that's what originally we were going to talk about, just about that sharing. But as we got into the work, and I'll talk about the research at the moment, it became clear, and kind of almost picking up on John's point, that there was a kind of wider need to sort of explain the benefits of sharing information to people, explain how this happens across all sorts of different health and care services, and also sort of try and build that trust and confidence that this is done in a safe and secure way. And that's a big part of the work. And also, almost we say, making sharing for patient benefit the norm, so that almost people think about sharing information for health and care reasons almost in the same way that a lot of other organisations share information about us, banks and supermarkets and all sorts of organisations. And, in this day and age, a lot of us hardly think about that. So we also want to make sure citizens are involved in helping develop the approach, and making sure that whatever we do recognises the wide diversity of our population, health inequalities. And also, because this is a project that's being supported by both the Dorset and the Hampshire Isle of Wight systems, we really wanted to make sure that we had a consistent approach of both areas, and very importantly that we're kind of sharing this information in understandable language, and I'll talk a bit more about that later. But when we started this work, I think it became clear to me that what we needed to do was find out more before we started working out how we're going to do this, find out more about what people's attitudes and understanding was to how their information is shared. Sorry, I've leapt onto that. I'll just come back to this a little bit, just explain this first. So the landscape for sharing information, I think this is quite sort of useful background, is that there are various different ways in which patient information data is shared. So on the left-hand block there, it's about sharing information for care and treatment. And this is about what I talked about earlier. When you go to a doctor or you go into a hospital, the clinicians there having access to your medical records so they can provide you with the care and treatment you need. And we have various IT systems that do that. We have something called CHI, the Care and Health Information Exchange in Hampshire and Isle of Wight. Dorset have something similar called the Dorset Care Record. And they are, as I mentioned earlier, kind of getting those systems to talk to each other through something called Wessex Care Record. And then moving along the line, we have various ways in which the health and care systems use kind of insight to kind of inform and develop health and care. And one example of that might be that a GP in a particular area might be able to see that there's a high level of people with at risk of developing diabetes or cardiovascular disease in their particular area. And by knowing those people, and being then, through a secure system, only the GP being able to see who they are, they could put things in place, for instance, exercise or weight loss or stop smoking clinics, almost to as a preventative measure to stop stop people becoming ill in the first place. That's a simplistic example, but that's what that second block is really about. And there, as ever in the NHS, we've got various complicated names for these different systems that you can see there. And then coming over the horizon, probably in the next couple of years, in our area, is something called a secure data environment. And this is where a secure place where approved researchers only will be able to access data derived from NHS records for the purpose of carrying out kind of beneficial research. But they won't be able to take that data away. They almost will go into the box and be able to work with it in a very secure and controlled environment to carry out research. So there's a whole range of different ways in which patient information and data might be used. And what people told us in our research was actually, we kind of don't, it's almost for you to look at the different programs. We want to know about this in kind of the broader sense and what you do with our information. And then, you can ask the question, why would you do that information? Here, the pink things, the pink boxes are some of the ways that we do, reasons that this information is shared. All of these things you'll find appear in the priorities for the two integrated care systems in Dorset and Hampshire and Isle of Wight. But, some of the stuff, as I talked about, targeted interventions to prevent people coming ill and to reduce health inequalities. And kind of the knock-on effect of that, if we can use data to prevent people becoming ill or give them early treatment, that in turn reduces the pressures on the wider system and the pressures on hospital beds and enables us to make better use of resources. So I mentioned earlier about the research. So last summer we had an online survey with residents. Got some really good results from that, but we felt the responses were quite biased towards the older sector of the population. To make sure we got a good balance, we did a follow-up survey targeted at younger people, aged between 18 and 40 this summer. And then, because surveys can only tell you so much, we've also done some follow-up focus groups, which I'll talk a bit more about in a moment. And that will give you some idea. We've did some general ones, but we've also gone out to each sort of different sectors of the community. So what did that research tell us? The main things that came out from the main research was that people there were low levels of awareness. People really didn't know or understand how information or data from the health records might be used other than for their own kind of direct care. They kind of got that bit, but not the other things. But where they knew about other uses, so improving care services or research into new treatments, they were positive about that, where they could see there was a direct patient benefit and it wasn't just about commercial drug companies making money. When we asked people what are their biggest concerns about their data being shared, the things that came top were one, the information, for instance, in my GP record might not be right in the first place, so we don't want you sharing my information if it isn't right. The second one was we don't want our data sold. The NHS doesn't sell data for commercial reasons or insurance or marketing reasons, but there are perceptions out there that does happen. And the third bit was data security and people worried about this is sensitive information, worried about data breaches, hackers, all those things have affected a range of industries. When we asked people what would give them the most trust and confidence in their data being shared, they said we want to know who's sharing it, what it's being used. As John mentioned earlier, we want to be confident that it is truly anonymised and I can't be identified from it. And going back to the last point, we want confidence that you're doing the highest levels of cyber security. When we asked people where they like to get their information from, they said probably directly from my GP or by visiting my GP website, or increasingly, we'd like to see information on the NHS apps or where we do things like e-consult, and maybe that reflects the kind of greater use of those digital tools for kind of accessing your GP and other services. They also said to us, when you explain this to us, some of the terminology you use might make sense to you, but it doesn't very clear and it can be confusing. And they also said, this is what's happening locally, but there are other programs going on, as the recently kind of announced program for enabling you to access your GP data through the NHS app, and we're we're kind of confused about how the two fit together. So these are all things that we've taken into account and are learning from. When we talk to younger people, actually the results were pretty consistent with the ones I've just gone through. Their biggest concern also was about data being sold. They were probably less worried about the accuracy of records. They had kind of more trust that the records are accurate, and less assurance needed about data security. Maybe because the younger population are kind of grown up more in the using IT and kind of less worried about things like data security. But knowing what data was used for and who could access it was a really big priority for them. And they said the place they would probably go for to get information is the NHS website. So as I mentioned, we then had some focus groups, and these were really useful in exploring this information or people's ideas in more detail. And just quickly run through the focus groups. So in the focus groups, the things people told us, the first two kind of follow up on the surveys. People are kind of generally happy with most of the planned uses for data as long as it was for their benefit. Interestingly, people said, yeah, we're happy for our information to be shared with private providers of healthcare. Again, if we know it's for our own benefit. And I think maybe this reflects that, increasingly NHS services are being delivered through private organisations or in partnership, and that perhaps reflects that. People very happy for information to be used for research if it was shared with organisations such as universities or charities. Mixed views on whether information should be shared by drug companies to do research. What people said, a bit concerned about what their ethics might be and also what might they do with the information. People in the groups felt absolutely information should not be sold for profit, reflecting what we've heard earlier. And there were kind of mixed views about whether private organisations should pay for use of NHS information, even when it's being used for kind of best beneficial research. So some interesting views there. Again, we then explored the whole area of what would give you most trust and confidence in your information or data being shared. And again, and we reflect the point we talked about earlier, people wanted confidence that other than when their information was being shared for the care and treatment, when the doctors or GPs would need to know who they were, if their data was being used for other reasons, they wanted to be, convinced it would truly be anonymised. That concern again about information being shared that was incorrect. But I think the focus group feedback was reflective in the surveys. The big things that people wanted to know were who their information was being shared with, how this was happening, what it was going to be used for, and who would be able to see their information. They wanted confidence that this was being done in a safe and secure way. We then kind of got into the conversation about should we ask for your consent to share your information. And people felt that in principle, yes, yeah, you should ask us before you share information, but they kind of recognised it might be quite pragmatic and recognised actually it might not be really practical to do this every time. There are hundreds of thousands of research studies that go on in the UK every year, and often that's just taking very small bits of people's data and including those in those studies. And it would be awfully labour intensive to ask you every time that was going to happen. So they felt that some form of blanket consent was probably the way to go forward. And then we got into a really interesting discussion, as I said, about the language and terminology we used. And it was a bit like playing a bit of a bad TV quiz show or a bit of a board game. I tried to ask people to I tried to explain something and then ask people what we should call it really. And interesting points come back. So the care that you get from a doctor or a nurse or when you visit a hospital, people thought we should call that personalised or individual care. Individual was actually probably favoured because some people said personalised could mean things like help with washing or dressing, and that wasn't necessarily what we were talking. What they didn't like was the word direct care that we use a lot in the NHS to describe this. They felt that didn't really mean a lot. We asked people, well, what should we be calling you as those people who are using health and care services? And they said, we want to be called people or patients. Don't call us citizens or residents, because we felt that was more about where you live or about having your council services or voting. And we do citizens a lot, so we're trying not to use citizens in this work now. They felt it was okay. So I think if in social care, we often use the term clients or service users. They felt that was okay where that was the established term used in that area of care, but not as a general term. We asked people what we should call the details that held about them, and in general, people understood or kind of got the difference that information were your medical records, the records that were held about you, but data was a more specific term, and it was about kind of sort of little bits of information about you that was combined and anonymized to be used for other reasons. We also then talked about, when we use information, but it's not about your individual personalized care, the NHS uses the term secondary care a lot. Nobody understood what secondary care meant. They said, don't use that. And they said, it's probably not worth trying to come up with one term that covers a range of uses. So it's better to explain to us what you might be using the information for. So we're using it to plan or improve services, or we're using it for research into new drugs or treatments. Don't try and wrap this up into one catch-all. People were generally happy with the term anonymised for information that they can't be identified from, understood what that meant. And we said, what would you call information about you that you're happy to have shared? And people said words like safe, secure, and trusted were all words that they felt could be applied in that circumstance. So that's really useful for me, because as somebody who has to try and put the communications and engagement material together, it helps me to make sure we're using language that people can understand. So as a result of all that feedback, what are we going to do? So we've got quite a few activities planned, and we're working on them at the moment, but they'll kind of be rolled out from October 2023. We're going to have a consistent kind of narrative around information sharing that we hope can be used across all the systems in clear, understandable language. We're developing some videos and animations based around real life patient stories to show the benefits of information sharing, but also explain how patient information is kept safe and secure. We're going to provide some updated content for things like the ICB websites. At the moment, they kind of have the bald sort of facts about information sharing, but don't do a lot to explain some of the stuff that people want to know around the things like the reasons and the benefits. We're looking at things like information leaflets and posters for GP surgeries. We'll use news and social media. Interesting one, I went and spoke to some groups of GPs and said, people have told us that if they wanted to find out about the information is shared, the first place they go to would be their GP or look on the GP website. How can we help you to get the right information across to people? And they said, provide us with stuff that we can use, sort of cut and paste and put into our web registration packs, our websites and newsletters. So we're going to work on that. And then I think probably particular interest is through a patient involvement network. We're looking at planning a program of kind of public engagement activities to explain this important topic more. We would like to provide information for patient groups and networks to share with their members. We're quite limited in terms of the resources we've got to do this work. So if we can get patient networks to help us to share some of this content we're producing, that would be great. And we're also looking at perhaps whether we develop a network of kind of engagement sharing sort of patient champions. I know there's similar champions groups around sort of areas like digital work who could sort of help us with spreading the word. And then also, this is not sharing information, it's just not in the realms of kind of primary care and GPs. We also would like to provide information that some of our partner organisations, some of the hospital trusts, local authority social care people can use. So that's our plan. and that's what we're busy working on at the moment. I think, as well as taking any questions from you, which I'm really, really pleased to do, I think some questions from me is kind of any thoughts on the plan. Are there ways that you think the patient involvement network could perhaps help us to get this information and engagement out there? And what would you, if you could help, what would you need from us to support you to do that? So I'll take the slides down now.